Hello and welcome to Filibusters in Fine Print, where AMGA's public policy team gives you the insider view on healthcare regulations and legislation. Thanks so much for joining us for the latest from Washington, D.C.
Welcome to Filibusters in Fine Print, AMGA's go-to podcast for all things public policy. I'm your temporary host, Daryl Drebna, and we're here with a much smaller team as our ambassador of goodwill, Jamie Miller, is on a diplomatic mission to Seattle, and Chet Speed is working with some new AMGA board members. So today we've got a public policy trio, and I'm going to turn to my right so we can start introducing ourselves.
Hi, I'm Lauren, Director of Government Relations here at AMGA.
Hi, Alicia Sawyer, Government Relations Assistant.
Sounds great. Looking forward to having a smaller team. I think we're going to do a really good job with this. It should be very exciting. One of the other things I'm looking forward to is our upcoming trip. Our annual conference is going to be in fabulous Las Vegas this year. I think pre-con starts on April 16th, closing out with a performance with Penn & Teller on April 18th. Alicia, what are you most looking forward to in Vegas?
Mine feels a little silly, but I'm excited to go to Vegas in the first place. I have not spent a lot of time on the West Coast. I've spent most of my time in the States in the East Coast, specifically like Florida, Virginia, DC. So last year was my first time in Texas. I'm looking forward to my first time in Las Vegas.
Okay, you're in for a treat.
Oh.
Lauren?
I'm looking forward to the councils. I think the council meetings are always really interesting to sit in on. I learned so much from them, and it's nice to be a student. I miss that nerdy part of like learning about stuff, so I'm looking forward to meeting a lot of you at the council meetings.
Sounds good. I always enjoy our policy panel discussion. That's going to be, I think it's 10 o'clock Saturday morning, so you don't want to miss that. It's always a good time, and you have to walk through the casino to get to it. So a lot of people watching on your way to a discussion about what's going on in public policy. So register, join us in Vegas. Should be a good time. I think what's also a good time is sometimes congressional hearings can be just a hoot to attend. If you've never been to one, it's maybe it's a DC thing, but I always like going to those. And today we're going to be talking about a number of recent hearings on healthcare affordability, and specifically how regulatory burdens and administrative complexity are driving up costs. So we're going to take a look at two hearings. There's the Senate Special Committee on Aging, and they had a hearing titled "The Doctor is Out: How Washington's Rules Drove Physicians Out of Medicine." And then over on the House side, the Energy and Commerce Health Subcommittee had a hearing called "Lowering Healthcare Costs for All Americans: An Examination of the Prescription Drug Supply Chain." So we've got three of us on the AMJ team here, two hearings at two chambers of Congress, and lots of bureaucracy, so we're going to get into it. Lauren, we're going to start on the Senate side. Special Committee on Aging. That's kind of it's right in the title. It's a special committee. Can you explain how this committee works and how it might be different from other committees on the Senate side?
Yeah, thanks for bringing it up. I think it's interesting because if you think it's a special committee, you would think there was a timeline to it as well. Like there was a special committee that looked at the coronavirus. There was one that looked at what was happening with the election. There are always these sort of small committees. This committee has been around since 1961. And it was a temporary committee, and then it was made permanent in the late 70s. And the thing that distinguishes a special committee is it does not have legislative authority. They examine policy issues, they conduct program oversight, and they elevate matters of national importance. But they do not make any products out of this that can be used to be added to legislation. So basically, it's at the will of whatever the chairman wants to explore. And the current chairman is Senator Rick Scott of Florida, who is a former healthcare executive. So it would make a lot of sense of why he'd be interested in cost control and administrative complexity, given his medical background.
Awesome. So I think that really speaks to the fact that, in Washington, nothing is more permanent than a temporary program.
We're operating on a CR still.
Yeah, CR
For years. We've been operating on a CR. Everything's been temporary for years.
Yeah. So, this falls in line with that perfectly.
Awesome. So we got a pretty good understanding of what this committee is all about. As we mentioned at the top of the program here, they just had a hearing. Can you walk us through what some of the key takeaways were from that hearing?
Yeah, it was an interesting committee panel. You had someone who was doing concierge medicine, which we see there's a little bit of shift toward. You see someone from an independent medical group. We love our medical groups. And someone also from the Lorna Green Foundation was fortunately a provider who completed suicide during the COVID pandemic, and just the amount of stress that was put on, how she was experiencing her life during that time. So I think it was a very interesting mix of folks to talk about just the difficulties of providing medicine these days. They really focused on federal policy, particularly Medicare payment instability, reporting requirements, par off, all the things that contribute to this workforce attrition and additional workforce stress. Strong emphasis on administrative waste. Strong emphasis on what are all the burdens and barriers that cause you to do all these additional documentations, compliance, paperwork, instead of just doing patient care. And that burden disproportionately impacts independent and small practices, as we've seen from our members.
So I think there's a nice overlap, or it fits nicely with something AMGA has been talking about for a while now, and that's the impact of administrative waste, on both the legislative and the regulatory, spheres. We've been talking about that for a long time. Yeah. It's something we flagged in our macro and value-based care task force. I know we've got a letter to HHS going in, a week or so. Is really going to hit home just how impactful this administrative burden or administrative waste is. So, I know the hearing focused on that. Did they talk about anything else?
So they talked about how burnout is a symptom, reimbursement instability, and administrative overload are the major causes of that. There's also discussion about how the Medicare physician fee schedule does not have inflationary updates, something that we also emphasize very heavily. Oh my God.
I know. I did not write the testimony.
It's our wish list for a committee that doesn't do legislation. It makes me kind of sad. And also when practices are facing rising staff and supply costs, but flat declining reimbursement, it becomes unstable. We've talked about this a lot, and this isn't just anecdotal. The senators really seem concerned about the access issues, particularly and always in rural and underserved areas, which is something we also talked about in the task force. And if providers leave the profession or consolidate, patients feel it. They feel, especially in rural areas, they feel the lack of having providers there. And so how do we make sure that we have a continued robust reimbursement to reflect just how costly medicine is right now?
So it sounds like a lot of what AMGA has been talking about for a while is really resonating with the committee and the team over there. Could it possibly be because our lobbyists have been hitting on these issues?
Look at this. This is so nice. See, thank you for that. I think one of the things that I really love working for AMGA is we've been talking about this since the 70s. These are issues that we have continually raised before I was here. And to see members of Congress in 2026 finally start to be oh, hey, here are some things that we want to consider. It's it may not come when you want it in terms of policy, but it also shows up right on time, right as we were releasing this task force stuff. And so we saw some themes that came up: payment instability, as I mentioned, streamlining reporting requirements, which I feel like is in every letter that you've ever sent to CMS or HHS, addressing prior authorization delays. This has been huge on Congress. Members of Congress are really focused on that, particularly in the MA space. But because, again, we're in a committee that doesn't create legislation, it's identifying the problem is easy. Actually, solving the problem is always hard and very expensive.
So, there's some themes. They're talking about our issues. So now the trick is we've got to get those ideas that are coming out of the Special Committee on Aging and then shift over into actual policies from, the authorizing and the committees of jurisdiction. That's the play?
Yeah. Okay. Resources aren't going to patient care because there's so much paperwork and administrative complexity there. And so we've been consistently talking about that. I think one of the things that I'm looking forward to in Vegas is hearing more stories from members of Congress. So we can share with members of Congress just what's going on the ground. They want to hear your stories, and please share them with us.
Cool. So anything in particular from this hearing that stood out to you from an AMGA perspective?
Just the fact that they're finally getting it, and they're finally realizing just like the current payment system that we have just does not work. And it's 2026. We need to reimagine what Medicare payment systems look like other than what we've been seeing since 1964, 65.
Yeah, no, you probably heard me say this. Like, this program predates the moon landing, right?
Wow.
Like,
Wow, yeah.
You know,
Reimagine Medicare should be the tagline then.
reimagining Medicare.
Reimagine. Yeah.
So, all right, sounds good. All right, so that's the Senate side. Let's shift gears a little bit and talk about what's going on over in the House. Energy and Commerce Health Subcommittee took a look at the prescription drug supply chain. Alicia, can you walk us through what you heard at this hearing?
Yes, this hearing was a part of a series that is being hosted by the House Energy and Commerce and Ways and Means committees on the healthcare system and affordability in general within that system and as it applies to it. The first hearing it was primarily focused on health plans. It featured a lot of health plan CEOs. And so this one focused on the drug supply chain and how money flows through the supply chain from manufacturers to wholesalers and to pharmacies, to PBMs, pharmacy benefits managers, which is a big focus when it comes to affordability in the drug supply chain for Congress. There was a lot of frustration voiced over vertical and horizontal integration in this area. Members examined a lot of where middlemen are driving up costs and whether patients are actually seeing the benefits of negotiated rebates. A lot of the top reforms focused on transparency, improving pricing and payment systems, and a lot of that relates back to the complexity of this area and clearing a lot of the administrative waste and burden created by that complexity.
Got it. So this has been going on for a long time. This debate's been going on for years. Was there anything, different this go around? Oh. And so we actually have...
We're a quartet now.
Yeah, we just added a fourth to our trio here. So
What are you talking
we're
about?
talking about the hearings. Alicia is walking us through what's going on in energy and commerce, drug supply chain. And so what's different this time, Alicia?
Yeah, so we're talking about PBMs right now. And
Very good. Am I interrupting?
Oh, absolutely not. You're never interrupting, Chet.
I think I am.
No, I don't think so at all. Yeah.
No.
You just took me off of the hot seat, giving me a second to, catch my breath.
Members come and leave hearings all the time.
That's
so
so
it's really,
true.
you walk
lot of
in, ask a question, leave.
Well, we have a new board members downstairs, and so in about 20 minutes, I get to talk about how great you all are. So I thought I'd come up and tell you that.
Perfect.
So you all can give you credit for telling.
It's on tape. It's on tape.
Thank you.
Hey,
Yeah.
can't delete the tape.
I'm sure AI is recording the stuff downstairs too. So.
There you go. Well, that's our next episode. It's going to be all about AI. So I figured.
You're ahead.
Yeah.
Okay. Yeah. Great.
Yeah.
I hate it.
Yeah.
We all have a great conversation. Hey, Mike. Oh, it's overwhelming. Okay.
All right. Well, enjoy the board.
Great. Yeah. And enjoy the PBM discussion. That'll be fabulous.
We're going to talk about all the ads you see about PBMs now.
Oh, yeah. PBMs, payers.
Mm-hmm.
Outstanding.
Yeah.
Okay.
Should be
Well, good to see you all.
Cool.
Same
All
here.
right.
See ya.
Sounds good. Thanks for swinging by.
Oh, yeah.
Sounds good. So I think the lesson here is we need to put one of those big red recording lights outside the studio.
I was so on call.
Awesome. See ya, chat. I don't think it was, but anyway. Alicia.
Yeah, so what was different in this hearing was the tone. PBM reform has been discussed in Congress for a long time, but right now we're seeing a lot of shared bipartisan frustration with this system. Both sides are upset about the lack of transparency. From a Republican side, there was a lot more focus on how do we break up some of this integration and promote competition, which the aim there would be to lower prices through competition. And then Democrats were focused a lot more just on the specific aspect of patient affordability and what can be done to make it more affordable outside of that. Lawmakers pressed witnesses on spread pricing, rebate structures, and again, the big focus was whether savings that PBMs are supposed to be accruing are being shared with patients. There was a concern that PBMs are leveraging the obscurity of the system to maximize their profits. And so PBM is one of those rare healthcare issues that draws interest from both sides. They're just not always agreeing on what the solution might be.
Okay. So yeah, I think, obscurity of the system, that really resonates with some of us, particularly those who spend our lives in the reg world. So yeah, totally get that. Let's pull back from the nitty gritty for a second and take a look, the 30,000 foot view of these hearings. What's the big picture here? What is tying these two hearings together?
Administrative complexity. This is also a beast of Congress's own making. So I don't know the accountability and transparency on their end is not really sort of reflecting in these hearings, I think, yet. Congress continues to make more complex things instead of trying to clarify and reduce stuff. So hopefully we see some of that. But on the provider side, it's regulatory reporting and payment instability. And on the drug supplier side, it's opaque financial arrangements, rebate structures. In both cases, complexity obscures accountability.
Cool.
Also, in both cases, Congress is wrestling with this concept of how to lower costs without disrupting access. It seems like every lever and level they try to assess has trade-offs to it. There's also a connection to the workforce. High drug costs affect adherence and patient outcomes, which affect provider workload in turn. We saw in the PBM hearing a lot of discussion on rural pharmacy deserts, and if patients can't access a pharmacist to provide them with the drugs, that adds to the physician workload. There's also the connection to an unstable reimbursement, which affects workforce retention. It's all a giant web affecting each other.
Yeah, it's all interconnected. I can appreciate how, if you're going to be held accountable for, patient outcomes and your patients can't afford their prescription drugs for whatever reason, it makes it really difficult to, one, provide the best possible care you can to your patient. But then, when it comes time for quality measurement, that sort of thing, you're going to get dinged and held responsible for that. So it's really complicated, kind of a mess. So, all right, taking a step back again, what should AMG members be on the lookout for the future as far as what Congress is up to here?
These hearings are going to continue. Right now, they're just sort of an examination and exploration of issues. So we're seeing by the end of the month, end of February, there's going to be a hearing on graduate medical education, something that we also have talked about and lobbied about as well as one of our legislative priorities. And then we also are expecting there is going to be a hearing on healthcare systems, and healthcare executives will be called in. That will be sometime in March. We don't know when. We don't know who's going to get called, but there's certainly it's going to happen. I think this is one of those things that everyone's going to have to sit in front of the firing squad, and so GME and providers will be next.
Okay, and so we'll have to get ready for that, and I think it speaks to there is a lot of focus on what is going on in the healthcare space in Congress, even though they might not be legislating or they might not be putting policies out right now. They're certainly in that information gathering. And how much of this do you think is, do they want a soundbite?
Oh, yeah. Yeah. It's wanting a soundbite. Affordability is she's that girl right now. It's a phrase that everyone is using. And I think you're also thinking about the fact that there's a midterm that's coming up in November.
Right.
And so having to be like, hey, I've tried to work on healthcare affordability, because it's not just, as Alicia mentioned, list price. Until you feel it at the cash register, you're still going to think there's issues at play here. And so members of Congress are recognizing that. And the number one goal of a member of Congress is to get reelected. And so that's always the magic potion there, and that's what they're aiming toward.
Got it. Alicia, anything to add?
I think that these upcoming hearings are an excellent opportunity for us to continue to push AMGA priorities, and so we'll see how our members can get involved with it.
Sounds good. All right, so there you have it. 3 policy staff plus a drop-in from our fearless leader, 2 hearings, and the consistent theme here is, complexity costs, right? Complexity adds to the cost of the system. So thank you for joining us on Filibusters in Fine Print. Be sure to subscribe, share with your colleagues, and stay tuned as we continue tracking congressional healthcare affordability.
Thanks for joining us for Filibusters in Fine Print. This podcast was brought to you by AMGA. For more information about AMGA's advocacy efforts, visit amga.org/advocacy.